you once again for joining in. As you all are aware, we did not have a webinar last week. I was at this time last week probably just sitting around on the beach watching my grandbabies play in the sand. So, you know, that sounds right now a little bit more exciting than talking about the PPACA law, but, you know, such is life. We'll dig right into it. You know, again, thank you so much for joining in every week. We do have a pretty full agenda today, and, you know, I've been talking about our employer marketplace for the last several weeks and giving you little teasers, and we've had some teasers in my newsletter, and I've been threatening and promising that Sam Bohr, our Director of Employee Benefits, would be on and explaining this program, and sure enough, I'm going to follow through on that this week, and without further delay, I will throw that over to Sam and have him present this exciting product that we're going to be rolling out that we're very excited about. So, Sam, thanks again for joining us.
Oh, thanks for having me. As long as you promise to come down and untie me from the chair when I'm all done.
Yeah.
So I'm going to figure out how to go full screen here and then show my screen. Or I guess you can see it now, Deb?
Yeah. Yep, I can see
right.
it. Just go to slideshow and you can go full screen.
Where is the button?
Up there, if you go to slideshow, Sam, that's how I always do it, like the icon.
Oh my gosh.
Yeah.
Thank you.
This happened.
Gosh, now you can see it now.
Yeah.
Okay, so as promised, we've been working really hard here at URL to give tools to you as agents out in the field that can not only help you grow your business, but it can help your clients, and it can reach as far down as the employees. So we're trying to help with a tool that's going to affect the way that benefits are presented, enrolled, and then administrated. So we do have what we're calling the employer marketplace. This is a screenshot. We actually have a couple of systems to pull from depending on the size of the group and the client that you're working with. But, you know, if you can just take a second and think of one of your clients, and speaking from experience, I'm a broker, so I sort of did this on myself and I couldn't come up with the answer. We have so many clients, and if someone calls, you know, what is the renewal date, or how has that census changed over the past year, or do you have that policy number for, you know, our group life policy, or what plans does this group have, or even, you know, where's that certificate? So the example here is Jay is on the phone. You know, do you have that information ready to give to him? So Jay's umbrellas, we just click on the group. We've got all the information at our fingertips. So we can look, we've got the address and the phone number, the email, we know what pay schedule they're on. Going to the next screen, we pop in and we see that the plan that they have for the group life is Kansas City Life. We've got all the renewal information, their policy number, which I've sort of blocked down at the bottom. We've got a link to enroll new employees straight from the site. And we also have a link to the certificate over on the right, which is going to pull over, you know, all of the details of the plan. That's good for you to have when someone's asking a question on, well, you know, who's covered, or what's the elimination period, or, you know, what is the definition of the disability or the life insurance. So on this one, we can also pop right down. This is a question I get all the time, and for the life of me, I always have to call back and say, you know what, let me get right back to you on that, because I have, you know, I can't remember. So here, the eligibility. You're eligible after 6 months, starting on the 1st of the following month. The employer is paying for this coverage, and they're paying for $40,000 for all people in the group. So just like that, Jay's on the phone, I clicked the button, I went straight to the plan that was in question, and I have all the information. There's also document storage. We can put change forms on there for you. We can put SPDs, conversion applications, sold case paperwork, original applications that were signed at the time they bind the contract. We can give different permissions to employers and employees. So employees can see forms that are privy to them, but maybe they don't need to see the group application, and they certainly don't need to see a lot of the HR stuff, so we can change the permission levels so that everyone has access. This is also document storage for your employer administrators, where they can put newsletters on there, maybe information about the company picnic at the end of the year. There's just unlimited possibilities with the machines that we have. So speaking of that administrator access, we can put change forms on here. Again, we can put the SPVs, conversion applications, the sold case paperwork. Gosh, it sounds like I just said that. So let me skip down to the bottom here. Resend logins to all employees. We can generate the smart forms, and we can send emails right from here. So it's a really nice tool to give your groups so that they can communicate with their employees better. Then we have a large group enrollment too. It's a little nicer system. They sort of have updated it and made it look a little prettier in the user interface. But we have the opportunity at the time of enrollment to capture the employee data, which is going to be a really important thing to have moving forward. We want their personal information, their address, their social security number, emergency information, dependent information. And then they would go through the enrollment period. And on the right side of the picture on that screen that you see, we're enrolling in medical, dental, vision, critical illness for the employee, but we're also offering it to a spouse and child, and then there's a long-term disability. So employee is going to go through each page. We can put videos in there. We can talk about, what is, why you should have voluntary life insurance, so they can go through a real nice user interface system to enroll in the product. And I get this too. I can't remember what I selected. This has a real nice system. When you're all done, it's going to show you, here's everything you enrolled in, here's what your payroll deductions are if it's voluntary. We can pull the reports then on the back end and give them to you so you can give them to your client, and then your client's going to be able to plug those right into payroll so that they don't miss the first payroll deduction on the new plans that the group is offering. So that really is everything I have to share today. There's so much more, but I was told I only have 5 minutes, so I'm sticking to it.
Well, thank you, Sam. I appreciate it. We're so excited about this this portal or this marketplace, for a lot of reasons, and quite frankly, for all of you as our agent partners, it's really going to benefit you not only on the enrollment cycle but also the renewal cycle, and we just think it's going to give you the opportunity to not only secure that health but also get electronically in front of every single employee about the ancillary benefits as well, dental, vision, short-term disability, etc., all of the things that Sam mentioned. So we're really excited about that. So keep watching for more to come. Sam's extension is 134, so if you want to bombard him, he sits around and twiddles his thumbs most days, so if you want to bombard him with phone calls, feel free to do so. Just kidding. But thanks so much, Sam, for giving us an overview of the program.
You're so welcome.
Thanks again.
Thanks, Deb.
All right. Aetna, same-sex marriage. Aetna is giving everyone 31 days. Well, they said members legally married on or after June 26th of 15 will have 31 days from the date of marriage to enroll their spouses, their same-sex spouse, on the plan. So I did want to mention that if you have any Aetna folks that fall within those guidelines, please, either give me a call or reach out to them, and if they want to add their same-sex spouse onto their plans, then please, take care of that within that 31 days of marriage. Next bullet point, FFM certification. Although the last 2 years it was released the first or second week of August, which is right about this time, it is going to be released September 1st in all marketplaces. This year, you will go on to the CMS portal, and you will select your vendor that you want to certify through. There are vendors that you possibly would have to pay to take their course, but you would gain CE credits, or there's just the usual site where you can go on and do your modules. So again, Once we get further clarification and the information on the certification for the FFM enrollment, we'll pass that on to you. I am planning on doing a webinar to go line by line, everything that you would need to do to support you in that, give you all the links. So don't stress too much about it now. It's going to be September 1st, so we have a couple weeks of reprieve that we can put that at the back of our mind, possibly. Speaking of things to worry about, you know, my husband says that's my superpower, is worrying. But this is something that we do need to take into consideration. Highmark does have a new special election period form, and a couple notes about that. I'll bring up the form, but applications through 8/1 effective dates through the balance of 2015 are all going to be submitted via paper. We need a paper application to be submitted, paper SVP form, and where the heck did that go? Paper SVP form, there it is. And you can see it's much more detailed in what it asks for and very specific about the type of qualifying event. But if you notice this block, the supporting documents that are required, unfortunately, this is the position that Highmark has taken, that because they're adverse selection, they are requiring proof of qualifying events. That's all I'll say about that. We'll help you through that as much as we can, but you do need to be mindful of that. Cat Blue Cross is also opening up their private exchange, or revisiting their private exchange, maybe. Maybe that's the wrong terminology, but it is going to be for the 20 to 50 groups, and it's specific to Cat Blue Cross products. So 20 to 50 lives on a segment can use Capital's private exchange if your clients are falling within those parameters. If they are on a Like It, Keep It plan or a grandmothered plan, this is not an option for them unless they decide to move to a PPACA plan. So I just wanted to let you know about that. If you have questions on that, I'm happy to help you with that as well. And of course, don't forget that they do have the self-funded down to 20 lives. So that the self-funded and administrative services only programs have really become popular, more and more popular. So when thinking about renewals, please just try to keep the self-funding in mind to see if that's the right fit for your group, and we will certainly quote it for you. Here's some confusing information. If you have a Highmark group in the 51 to 99 lives, they're giving an advanced option for this segment, which means that any group that renewed or had a renewal from January through June of 2015 could lobby, pre-qualify, if you will, to move to a 10/1 effective date and reset their renewal, so that, of course, their renewal in 2017 ends with the end of grandmothering provisions. So if they renew, reset their deductible for 10/1 of 15, they'll renew 10/1 of 16 if it's a grandmothered plan, and then quite possibly, then again, end their grandmothered plan on 17. So you see where the industry is going. They're all trying to hook up to that 10/1/17 date. For the July and September renewals, they'll stay as they are, and then October through December, or October, of course, will have the option to renew. They'll be the same. So I know that's kind of confusing, but we do have several groups that fall within this guideline for brokers that have written through us, and we'll be reaching out to you and letting you know the options for that segment. And that really brings us up to the end of our agenda. As always, I ask you every week, how can I help you? What do you want to learn more about? We do, again, have a little bit of downtime and lead-in time until 11/1 when the FFM opens. But we're all going to be very busy with our 10/1 renewals and 12/1s. And the 12/1 renewals for groups are coming out even as we speak. So again, I know it's going to be busy, but if you have something specific that you want to learn about within this time frame, I'm happy to do that. But please know, outside of this half hour every week, we can help you strategize on each and every one of your groups and help you really present the best group option for your group. And with that, we'll open it up to our open forum. I don't know how many questions I have. Nancy is asking what the cost of the system is. And Nancy, I'll have Sam could reach out to you. There is different costs associated with the plan based on the size of the group, etc. But it's very reasonable and certainly below anything else in the market. Dave says, I believe we can bypass the Highmark SEP paper form by enrolling clients through the marketplace even if they aren't receiving a tax credit. Is that correct? That's absolutely true, Dave. If you want to go through healthcare.gov and let them know that they're not looking for a subsidy and just do the enrollment, absolutely. And Sherry says, can you talk more about your individual quoting tool? Sure. Right now, we, URL, are using two systems. We're using the EBIC system, and that's something that we offer free to all of our agent partners. You can log on to our site and use the EBIC quoting portal. It quotes all available plans in Pennsylvania based on the zip code of your client. We are also using the My1HR, which is also the INSX Cloud system that does the FFM enrollment. It's a quoting portal, but then it redirects to the FFM for the FFM or healthcare.gov enrollment. We use that for our enrollment services that we offer as assisting our agent partners on their enrollments, and we use it as the quoting portal as well. So they're both good options. There are a lot of good options out there, but those are the two that we're using. And if you want more information on them specific to the contact information to see if the systems will suit your needs, then just let me know. So that's pretty much it. It's about 10 till 10 and finished up pretty early. I guess I should have given Sam some more time. Oh, Jim just asked a question. Do you foresee a more competitive individual market in 16? Yeah, Jim, I do. The rate filings are on the insurance department site, but there are two other opportunities for carriers to file. And I know that they all had to initially file, and that was prior to any of the risk corridors being released. One risk corridor was released, and now there's another one that's still up in the air. And I was told, depending on some of the reimbursements or payments from that second risk corridor, depending on how they come in, is how they may refile up or down on their rates. So it's still very early to tell, but I do believe that it will be a more competitive market for a number of reasons in 16. So I hope that all helped. Again, thank you so much for joining in. We will have a webinar on August 13th, which is next Thursday, 9:30, same time every week. As always, I appreciate you tuning in, and I appreciate your business and your partnership, and I look forward to working more closely with you and certainly gaining more consumers and clients for you and helping you through that process. So until then, until next week, have a great day and a great weekend. Bye-bye.